We're missing the nuclear people. This is just when I need them. People might be aware that regulations came down just in the last couple weeks that would be requiring certain things through to do with alcohol and drugs with nuclear. And they've asked me to just give some highlights of what's in the regulations. It's Fitness for Duty Volume 2, and it's specifically around managing alcohol and drug use. So this is the first government at any level, provincial or federal, that's actually issued legislative or regulatory requirements for their members to have to put something in place to deal with alcohol and drug issues. So what their focus is workers at high security sites, and the requirements apply to safety critical or safety sensitive positions. And I'll show you what their definition is. They're saying that the regulations are coming down consistent with the Atomic Energy Agency regulations for all nuclear facilities. They're expected to have guidelines on fitness for duty related to substance use. They're expected to have methods to identify those with a tendency towards abuse, and advise that personnel prone to alcohol or drug abuse cannot be employed in safety-related tasks. So that's kind of the basis for why they moved forward with this. And it's been in the works for quite some years. I started working with nuclear in 1995. So this has been in the works for quite some time. But so what the regulations have said is the facilities are to issue a policy statement that prohibits reporting to work and remaining at work under the influence of alcohol and illicit drugs. Prohibit bringing, keeping, or consuming alcohol, illicit drugs, drug paraphernalia, or prescribed medications without a legal prescription at a high security site. So they're basically covering the whole gambit for any product that someone might bring on. The only hole that I've got is they've said alcohol and illicit drugs. We got mood-altering substances out there as well, and we should be prohibiting anybody from reporting under the influence or having in their possession mood-altering substances, because once marijuana is made legal, it's still a mood-altering substance. So it's something that's going to have to be addressed in the actual implementation down the road. And there's also all sorts of things like synthetic marijuana and Dota and aerosols and all sorts of things that people use to get high that may be legal, but they're still mood-altering substances. So there's one little gap that I saw that might need to be addressed. It reinforces the responsible use of medications and a process to follow if a medication could impact somebody doing their job safely. And it also says that the policy needs to describe the responsibilities of workers, supervisors, oversight personnel, escorts, to report any concerns they have that someone might be under the influence. And then the policy is expected to define responsibilities for those involved in managing worker fitness for duty, including external organizations like SAPs, testing services, et cetera. So they're also to have a process to assess fitness for work and determine if alcohol or drug use or abuse is a part of that situation. Because there's lots of reasons someone could be unfit for work. So a subset may be alcohol or drugs. So the whole policy is around fitness for work with also some direction around alcohol and other drugs. They want a referral process, which I expect all the facilities have in any event, to guide workers to seek assistance from appropriate resources. Ensure there's access to employee assistance services, include peer observation and reporting, provide supervisor awareness training, very fundamental, important part of implementing any policy, and provide training, education, and awareness for all workers subject to the program. And of course, as everyone should do with any policy, they're expected to review and update as necessary the policy and the training programs and keep them fresh, keep them moving forward on an ongoing basis. So that's what they expect in the policy. But what they've done is instead of it covering, the regulations covering all of the facilities, they've limited the regulations to cover safety sensitive and safety critical positions. So safety critical positions would be workers classified under Class 1 Nuclear Facilities Regulation 9.2, excluding certified health physicists. So can you explain what that is, you guys?
You have your finger kind of on the button of the nuclear reactor.
Okay. So you could blow something up, like. Okay, because I started going through the regs and I couldn't figure it out, so. Okay, oh, so it covers the gun carriers.
The nuclear response.
Okay, great. And then, the nuclear response force would all be covered. So those are safety critical, and there's higher standards for those that are in safety critical positions. But they're also covering safety sensitive positions, which are the certified health physicists, nuclear security officers, and designated non-NRF personnel, and emergency response teams, fire brigade. So the program doesn't cover anything beyond that. The regulations are very specific to cover just those two classes of positions, okay? So within that, alcohol and drug testing is required as a final condition of qualification to a safety critical position, not safety sensitive, just the safety critical group. They have to pass the test in order to qualify for the position, and it applies to all new hires as well as existing employees transferring into a safety critical. And this is pretty standard in setting up any applicant testing program. Now, reasonable cause testing, where there's reasonable grounds to believe someone's under the influence of alcohol or other drugs, would be there for workers in safety critical and sensitive positions. And the requirement to go for the test as a result of their unfit for work investigation, the requirement to go for the test would need to be verified by at least two people, one being a supervisor. And it's pretty normal to have a second opinion, not usually two second opinions, but it's pretty normal to have a second opinion. It's also part of an investigation into a significant incident for both categories of jobs where the actions or omissions of the worker may have caused or contributed. And we had a little debate about this in the early stages when the regs were being written, that serious incident, you do not need reasonable cause. And they made the change in the regs, and so they're separating and distinguishing between reasonable cause as part of an unfit for work investigation versus significant incident as part of the investigation. But it's again limited to only those workers who acts or omissions contributed, which again is pretty standard in what we're putting in policies across Canada. Yeah.
You were transferring from one safety critical position to another safety critical position, would that be?
No. It would only be from non to critical. Yeah, because they're already in the role. So, yeah. So if someone's determined to have a dependency or substance abuse issue, and that's determined through a health professional, then in order to get back on the job, they have to pass what's usually called a return to duty test, and then they would be subject to unannounced follow-up testing for a minimum of 2 years, but the regs say that that can be extended further, and that would normally be on the advice of the substance abuse professional who looks at the whole situation and determines if it should be extended for a longer period of time. And random testing is for critical positions at a 25% annualized rate. So I think I was told there's about 1,000 safety critical in the whole system. You guys would know better.
We won't have 1,000, but I don't know.
No, for the whole thing, like Pickering and like the whole, for the whole system. Okay. There's no reference to testing in a post-violation situation. Oh, sorry, did someone have something to add? Oh. Yeah, Aaron mentioned that the other day from the commission, and it sounded like about 1,000. Now, there's no reference to testing in a post-violation situation, and I think that's something the industry is going to have to deal with, because if somebody violates the rules, goes for their assessment, does not have a dependency, what do you do with them? Like, you can't, do you fire them? Or because you've got no duty to accommodate, or do you put them back on the job? But if you put them back on the job without some kind of monitoring program where someone's crossed a line, created a safety risk, or caused an accident, you have to have something in place. So I think the facilities are going to have to make a decision on that, because there wasn't anything that I could find in the regs, in the draft regs. For the breath testing, they're expected to use trained and qualified collectors. Now, it says they could be internal or external, but then on the drug testing side, it says they recommend be external providers. So they want evidentiary breath testing instrument approved by the Alcohol Test Committee, which I expect will be the same as the conforming products list from the US government. So that's the kind of thing they looked at. There's two standards. If it's below 0.2, it's a negative. If it's at 0.2 to 0.39, the person's removed from duties until considered fit to return. And if it's 0.4 or above, it's a positive test and a violation. And that's standard in your industry and what we've done at the various other electrical operations, power operations. So the reason it's not 0 is these breath evidential devices are calibrated to be absolutely accurate at 0.2 to make sure that there's no naturally occurring alcohol in the body as the result of a side issue like fermentation of food. So just like for the marijuana testing, when they do the screen, that screen is set high enough to eliminate secondhand smoke. So with the breath test, they're setting it high enough to eliminate any side issues so that if it's 0.2, they definitely ingested a product containing alcohol. So for safety reasons, removed from duties until safe to return, usually until at least the next shift. And 0.4 above, that is a positive. And that's standard within company programs in Canada. But it was weird because there's reference to refusal to test having penalties for that for the drug test, but it was silent for the breath test. So I'm not sure that'll still have to be dealt with. Again, for the urine testing, use trained and qualified collectors. They can be internal or external, but they recommend using external. The lab needs to be certified by SAMHSA, which is a certifying body out of the States for any of our programs that all our cross-border drivers have to be subject to. They have to use a SAMHSA certified lab, so they've said to the facilities they need to use, and we do have a SAMHSA certified lab in London, as well as a screening lab in Edmonton, but I guess that doesn't really do any good for you guys because you're all in Eastern Canada, so, oh well. Okay.
That's just for confirmatory.
Yes. But they're not letting you do quick tests. It has to be a lab-based test. Yeah. So I couldn't see anything, and I'll go back and look at it. I've got them on there. I'll go back and look at it, but I didn't recall seeing anything where you could do a quick screen and then a confirmation in the lab. What it looked like is the same as the US nuclear, which is you have to have both the screen and the confirmation done in the lab. I'll go through it again and just see what I can see, but it didn't jump out at me as allowing for that. They did make it very clear that the medical review officer, as Melissa was telling about earlier, reviews the positives, adulterated or invalid test results that come from the lab. And then if they feel that there should be a mandatory referral for a fitness for duty assessment, they're expected to make that call. So let's say somebody has a legal prescription for an opiate product, but the numbers are so high that the MRO feels there's a safety risk, then they would be expected to recommend on that fitness for duty assessment. And then it's up to you guys to then take that to the next step. Again, under the recommendations, there's some shalls, there's some nice to haves, and there's some suggestions. And under the recommendations, they did recommend using a third-party provider for all of the testing. They want you to have protocols for dilute results and refusal to test. But they didn't mention the refusal in the breath test, and I think the facilities are just going to have to, it's the same thing, so they'll have to deal with that. But there's no option to use oral fluid, and you guys heard a lot more about oral fluid from Melissa this morning. There is no option, it's strictly the urine testing confirmed in the lab. So, oops, we're not clicking. Oh, I clicked the wrong button, sorry. So if someone has a positive test result, they're removed from their safety critical, safety sensitive position. There's a mandatory referral for an assessment through a substance abuse professional. However, the qualifications were a little vague in terms of what qualifications that SAP had to meet. And I asked Paul to take a look at it as well. And what were your thoughts?
Yeah, I think vague is probably a good characterization. It refers to a duly qualified health professional, and that's a good start. But it doesn't really spell out what organizations they would belong to. There's a list, but it is not an exhaustive list, and it suggests that maybe the licensees you could consider other qualifications as well. And then in addition to the qualifications, it's nice to have the competencies of what exactly the person should have in way of training around substance abuse, and also in terms of what actual criteria they're going to follow, so that everyone is having the same process. So I think there's some more fleshing out to do there.
Yeah, exactly. The U.S. regs for nuclear have been in place for quite some time, and they were very clear on the qualifications of the substance abuse expert, and that they use that term. But so that, yeah, they were a bit vague. And the list of qualifying agencies for the SAPs, or certifying agencies, they don't certify SAPs. So
Yeah, that's right. They're professional organizations,
absolutely.
But they don't have any kind of SAP certification. So there's that competency there that would be, you want to make sure that the person has.
Yeah. And then, they also said referral for assessment can be in other situations, which is good because, as Paul said this morning, if someone reaches out for help for a problem, they should be assessed because now you have knowledge as an organization that there may be a problem there. So that's where the SAP should also, but they didn't make it mandatory, but they just said that could be done. And then if someone's assessed as having a problem, they can't return to safety sensitive or safety critical position until they've met any directed statement requirements for reinstatement. And they say consider relapse agreements. I would say you always would have a relapse agreement. If someone's coming back, especially into a safety critical or safety sensitive position, we know relapse is a function of this disease, so you would want to make sure that there was an agreement supporting their continued recovery. So they suggest it, but I would say to the industry, you want to have that no matter what. So other issues, there really was no direction on the consequences, as I said, of a violation or conditions of continued employment, separate from the SAP part, but just someone violates the rules and does not get assessed as having a dependency. There was no direction there on that. Possession is banned, but there was no real direction on searches other than to say you could consider drug dogs, scanners, and physical searches. There was no direction on impaired driving in conjunction with work. Usually we deal with that if someone's operating a company vehicle, operating a company business, but maybe these folks in these categories never do, so it might be irrelevant. But the testing slate includes the expanded opiates that the US government is doing. They're adding oxycodone, oxymorphone, hydrocodone, hydromorphone as of January 1st. So the regs do include that expanded slate, but they also added benzodiazepines and methadone, which is not on the standard slate. But so now they have an expanded slate. And it was silent on any kind of extension of fitness for work policy beyond safety sensitive positions and safety critical ones. It was just silent on that. The real focus is safety sensitive and safety critical. So that's where that stands. Does anyone have any questions? Because we have people from nuclear here that might be able to answer them. We just wanted to make sure you were aware of what was coming down. Yeah, Jeremy.
So one comment, or question I always get asked is what's considered safety sensitive or safety critical? I know a lot of it comes back to the company and their description. Do you want to elaborate on that?
I can't, because it refers back to the regs, and so it's the guys that press the buttons or carry the guns.
Okay.
I can add that I know, so there's a few other organizations in this room who have participated in that, and who have participated in that. We have actually defined criteria for safety sensitive work, and so we, as a Can-Do Owners Group, have developed basically a criteria to determine what other positions might be included in that.
Good. Other questions? Well, they're taking a leadership role for your industry, which is great. And just before I talk about the other policy stuff, people are often asking me what's going on with Toronto Transit Commission and what's going on with Suncor. So I thought I'd just update you guys on what's happening there. So with Toronto Transit Commission, the Amalgamated Transit Union challenged their policy. The arbitration started 7 years ago. The union is still entering its evidence. I've done 2 witness statements, and I'm going to have to do a third one because this has gone on for so long. But in the course of the program up to date, they were allowed to carry on with the reasonable cause post-incident applicant testing, et cetera, the searches, whatever, everything else we had in the policy, to the point that they felt they had sufficient proof of a problem to meet the Supreme Court's direction that in a unionized workplace, you need to show proof of a problem in order to introduce random testing. So they felt they had that data and they introduced the random testing. The union got an injunction against that and they went to court and the injunction was overturned earlier this year. So they did start the random testing program. But the arbitration carries on. And at the end of the day, the arbitrator gets to make the final decision on whether they can do random testing, even though the Superior Court in Ontario said they can do random testing. So it's kind of a lot of, sorry lawyers in the room, but a lot of lawyers are making money from this because this is just dragging on for so long. It's unbelievable. But so they haven't won, but they were able to start the random testing pending the arbitration finally getting done in the year 2030, when we'll find out from the arbitrator whether she's going to allow it or not. So that's where they stand. And with Suncor, they have a comprehensive policy. It included random testing, and the union got an injunction against them starting the random testing, so they didn't start anything. But they went to court, and eventually, about a month ago, the Alberta Court of Appeal said that the original arbitrator had not interpreted the Supreme Court correctly. The Supreme Court said you need to have proof of a problem in your workplace in order to introduce random testing. And the arbitrator looked at it as proof of a problem in the workforce, meaning just the uniform employees and not the broader Wood Buffalo safety risk sensitive operating site. So it went through the courts. The Court of Appeal said wrong, interpreted wrong. You have to go to a new arbitrator and start again. And they overturned the injunction. So Suncor announced a few weeks ago that as of December 1st, everyone that has a safety sensitive position on the Wood Buffalo site, which they estimate to about 35,000 people, will be subject to random alcohol and drug testing effective December 1st. So they're carrying on with that, and Unifor immediately said they're going to take that to the Supreme Court. And I don't know what's going to happen in terms of getting another injunction against the December 1st thing. Can you believe I remember all this stuff? It's just, yeah.
For the nuclear regulation, how did that go over with labor?
Not great. They've clearly indicated they're going to challenge it. We were talking a little bit about that.
Yeah.
I don't exactly know the mechanism in which they're going to challenge it. But they've been clear throughout the process because it has been an ongoing doc that they've had the opportunity to give submission to. It's been clear throughout it that they're opposed to. Essentially, the privacy is what it seems to be they're hanging their hat on that it challenges the privacy of their members.
And does it sound like it's primarily the random that they're focused on as opposed to the broader regs?
I think you're right on that.
Okay. So we don't know, like with TTC, it's a charter challenge, and it's the first one that's taken place in Canada where a government agency has issued something that the workers feel are against their charter of rights and freedoms. So they're working it through that angle, even though they're starting with an arbitration because you have to get into the courts somehow. So we don't know if the unions for nuclear will do the charter challenge route or something else. I don't know. So it's all quite complicated, and random testing in Canada is not easy unless you're a truck driver does cross-border work, and then you have to be compliant with the U.S. regs.
Anyway.
Oh, well, yeah, Quizinators and all that kind of stuff, yeah. Okay, so that's a little update on what's going on with the cases and everything.